Hey, Dr. Olsen, can you tell me a little bit about the CNS-VS test that we offer and what it's going to help to identify?
Absolutely. First, introducing myself. I already have to some extent, but this is Dr. Greg Olsen. And the question is about the CNS-VS test. So what that means is central nervous system vital signs. So what that means is it is a neurocognitive assessment. So what does that mean? So it's a big word. It basically says we're going to check to see how your brain's working. And why would we do something like that? So we're looking at doing something like that in a situation where you might be going, how's my brain working? And so sometimes that happens if somebody's a little bit older and wondering, hey, people have been telling me that I'm just not remembering things, or I feel like I'm just not keeping track, or sharp. And so this is a brain health assessment. It's a neurocognitive assessment. It does some evaluations to say or measure how is your brain working and performing, and then it gives us an actual score called a neurocognitive index, and we look at that in relationship to your age and what you're actually experiencing to determine if, hey, is this something that we need to look at a little further? Yes, there's something here. Or, hey, no, you're actually performing pretty well for your age, and you just might have times where you could be hungry, you could be a little hypoglycemic, or a little stressed. That might be creating some of those situations. Other times where this is used would be if somebody may have had some kind of head injury. So again, looking at brain health, brain function, if you have had an injury, somehow your brain's not performing like it should, then you're going to see when we ask your brain to perform certain things, whether it be memory or calculations or movements with the hand, where your brain has to tell your hand to do a fast tapping test, it's just simply not going to do it. So that'll reflect back again as either an overall low score or very poor scores in individual sections, which would then look back and say, yeah, there's a problem here. Let's take a look at it. Or there's not, and it says, hey, we're good. Let's move on with these things that are not brain related, because things seem to be in good shape. So that is what we do here in terms of one of the tests called the CNS-VS, Central Nervous System Vital Signs. And again, it can give us some really great information on what to do and how your brain is performing. So thanks for listening today. Stay tuned. We've got lots more for you.